just like to draw your attention to two pages in your information package. One is an evaluation form, page 9. It's in your package. So we're asking you for feedback and also some indication whether you would like to be involved going forward and come to other meetings. So there's a form around that. And we put a copy of this survey that was on the website in your package. Unfortunately, we didn't put the website, so we will do our session evaluation and mail this back to you, this website, this survey form, because the results were very interesting from the first group that responded to them, where we found that many of the people who initially completed the form, that they were moving more towards medical administrative jobs in the first go around, rather than more research, medical education, those kind of positions. And I think that's because people need to survive, right? And so they'll go to that in the first instance. So that was very interesting in the first area, and this is in your package. And the second thing that we found very interesting is we're asking people, are you involved in retraining or working for licensure? And it was 2-to-1 retraining versus licensure. So I don't know that that corresponds to what you know, but we are very interested in continuing to collect this kind of data to understand who our constituency is as we collectively work with other organizations. So the information helps us to devise better programs. So it is 8:15. I really appreciate it that you've sat here for so long after a long day. So what I will ask you to do is go by group. And I'm just going to go by color and ask the reporter to give us the information about what you as a group saw as the two main priorities for short-term and long-term. The next group, I will just ask you to add anything different, right? And so we'll go through and see what we get that way. And I'll just circle which ones come up most often. So, red group.
It's purple, actually.
Purple?
Yeah. Well, we have the red one. I will ask Nina.
Okay, do you want me to actually come up?
Yeah.
You just stand up.
Oh, okay, so that's a lot easier. So we had a couple on that list. I guess if we have to prioritize. One of them would be to raise awareness at the embassy and at the immigration authorities, to provide a booklet to people as to what are the actual exams and qualifications needed, because most of the embassies, they just say, you know, we need doctors or we need pharmacists, which is all very nice, and you know, it's a flowery view of the world, but you don't really know all the exams needed. I think tied with that would be, okay, we need these people, so if you're a graduate of this country, then you need to provide these exact qualifications. If you're a graduate of that country, you need to provide these exact qualifications. I didn't have a chance to add that in, but just as a continuation of that.
Number one.
So that's number one. So that's at the local level, I think. At the more international level, or at the longer term, what did I put there?
We are dependent on immigrants for population.
I think the idea is that, you know, Canada is inviting all these new immigrants to come in, but there should be mentorship and, you know, some sort of support for the actual existing highly qualified immigrants. So that would be the second one. As a priority. Thanks.
Just so you know, we will write up all of these reports so that we'll have a lot more information. And we don't want to give you short shift, but we know that you're tired and have other priorities in your life. So, black group.
No, we are black group.
But this is black group. It's that kind of color.
Yes.
Next group.
Our black group the end. So
Okay, let's go over here. And the thing, in addition to
Next.
this, anything different from what you have?
Yes, he was. We're talking about helping with the.
Stand up, please.
And I want Luke also to explain his point of view about if you're to inform doctors that if they don't have enough time for making like sutures or any maneuvers, so he can train another doctors to assisting them to do this in order to save time, and also they can be paid for this as an incentive. I think you can explain it better than me, or what is that,
Physician
you know?
assistant, right?
Yes,
Yeah.
like I said.
So physician assistants. So if there's any procedures in examining wounds that board-trained health professionals could be helping the doctors with appropriate support.
Yeah, they can train us for what they need and what they want, and so we can just help them to save time and
Good.
get more money. Also, she suggested to help people to make the resume, and I think this is your point also. Not only how to make the good interview or the proper one, we have to update our resumes in order to fulfill all the data they need in order to accept us for jobs. I think this is something else. So I want to continue long-term. Yeah. The study groups, yes. It's not to be small groups, make it for the community groups to talk about our problems and how we can, like we are making in community matters, to extend this to other places.
Oh, okay, so
Yeah.
more study groups
Yes.
in different parts of the city?
Large scale.
Like pharmacists together.
Yeah,
the physicians
like
together.
the study.
And we also need to
Expand
focus.
it.
This one. We need to focus also about the language training, because we have like we all have the problem to pass these language tests, which is mandatory for passing the exam. Like if it's not the first or second language, English. We studied in English, but it's not our
First
mother
one,
tongue language.
mother tongue.
Thank you.
Very much.
Okay, so something different for the, okay, I can go there. One thing, in the long term, we would like to separate the IMGs from FMGs, because offshore schools offer $10,000 free help for their IMG graduates. FMGs. So international medical graduate Canadian people going to offshore schools coming here, they have an advantage. So in the future, to have separate seats and separate applications, so that's one of the future. Also, we to some financial support for from the government for IMGs doing their exams, either in tax incentives, daycare, or some support in this respect, so we can let them focus on the exams. Resume build up done in partnership with universities in Toronto. So my group actually offers 40 projects to IMGs, and we help increase the impact of their CV through different biomedical projects. I think that these are some of the things that we came up that are embassies, all the other were touched upon. So these are.
Thank you. In the back? Anything different?
The pharmacy program. You can explain.
The pharmacy program. Go ahead.
So we're just talking about maybe in the future to start thinking of developing a bridging program for internationally trained pharmacists so they can upgrade their credentials to PharmD.
There was a bridging program, right? But it was like a pilot and then you have to pay for it. So
For PharmDs.
for pharmacists, you know.
PharmDs, no,
Oh,
that's
pharmacists.
pharmacist.
Next table. Read, can you report it?
Yes,
Rita? You done? Okay. Anything different?
So I think a couple of things that we talked about were bridge training, short bridge training opportunities. So I can tell you the physician assistant, the PAIP program did occur in 2009. It was a pilot program for international. It doesn't exist anymore. So it was a pilot program in 2008, and they did take some international medical doctors with exam eligibility. And for 2 years in a row, I think, from different perspectives, it was successful. That there are still practicing PAs now who went through that program, and actually some of them were actually master residency as well. It was a pilot program prior to the McMaster and U of T programs being established. Now that the U of T and McMaster programs are established, the PAIT doesn't exist anymore and likely will not happen again. So, but if, I think our group had discussed about other opportunities such as the PAIP, whether that could be a possibility, whether shorter term PAIP that doesn't exist anymore. It was called the Physician Assistant Integration Program, but it was 2008, 2009. But I think the group had discussed other possible short-term bridge training. So some of the healthcare professions do have bridge training already, but I think for doctors, we don't have any.
Yeah, there's no bridge training.
What's that?
Because we do any else with bridging program, but
Right.
like bridge.
And I think, this is part of the challenge along with the IMG, IND, FT, we can't always land on the same terminology, so we can't be clear that we're all talking about the same thing. So when I think, MCI, when I'm talking about bridge training, I'm talking about training to registration in college. So in terms of the regulated healthcare professions, bridge training that leads to registration in college. I think that term bridging has become quite broad and used in many different ways, sometimes for observership, sometimes for language, but I'm talking about the regulated registration of colleges. So we talked about, is there a possibility for shorter term training? I think we should look for some more things to happen in the next year or two. We'll see what gets funded this year for other bridge training programs. They may be alternative pathways as opposed to the regulated healthcare, but it's something to stay on the alert for sure. Biotechnology could be one of them. Vocational rehabilitation is another sort of parallel path, but if licensure is your thing, then that's probably not the case. And we also talked about language. So language in two different capacities. One being training for examinations, IELTS academic exam training, but also at the other level, not the communication, not the the English can be strong, but the slang. So calling your body part something else that may not be something that you know right away. So looking at language from the idioms, slang, that's the level that you may be communicating with your healthcare consumers, which can be challenging. Idiom and slang in different languages can be challenging. So English itself is strong, idiom slang can be challenging, as well as high-level sort of academic examinations. And did I miss anything else? We talked about those. So bridge training as a short-term program, and then language and
Bridge training is a short term.
is bridge training longer? We didn't really discuss it in the context of short.
It's a good recommendation.
Now. But
followed some of the things. We were trying to find something that we could actually affect. So the number one concern for us was kind of consolidating all the information. Because through my 7 years working with IMPs and everybody else's experience, you can waste a lot of time not knowing what your first step should be, what your second step should be. So if we could, somebody even talked about a helpline, dial 911 to get help for, what is the first step, what is the second step. And then that would be our immediate priority. And have that central repository kept up to date and maybe shared at point of entry. So at the airport, there's a package handed to you. If you have any questions about this, this is the number to call. And just make sure, like the 211 service, but make sure it's kept up to date. This,
Good one.
what's just me, everything. And then the second thing was access to, placements and stuff locally. That would be a great thing. And third, financial support for exams. Those were in the short term. And then jumping off that for the long term, back to the information.
Excuse me, what's the third one?
Financial. We were following your list and kind of prioritized.
Go ahead.
In the long term, if we got that information package really good, that you could publish it or something, and make sure that the embassies know that information, so that they're giving accurate information to people at time of application, because if anybody ever asked me before they came, I would say, get your exams done before you arrive. Even if you have to fly to Canada once every 2 years to get the exam done or whatever, it would be better than arriving and starting from scratch. It's easier to pay for them when you have income than when you're here and you're living on savings. So somehow disseminating that information to the embassies so that they are giving a more useful and realistic understanding of what you're really going to face here.
Okay, that's good, because it's both a short term, you can do something immediately.
And then you can build on it long.
Thank you. Table, back. Anybody, anything different? I'm gonna move on soon, guys.
Well, we can add a few things. So first of all, regarding the physician assistant program, so I'm an interviewer for the physician assistant at the University of Toronto. Before actually applying for this program, you must really check, because some programs in different provinces, once you apply for this program, will never allow you to apply for residency. Because what happened is that lots of IMGs apply for the program in order to get a bridge until they will match, and then they remain without their candidates. So to make sure.
You're not recommending that.
No, I strongly recommend, but some programs, you either will become physician assistant or you will never be allowed to apply for the residency. So you have to decide about your career. So this is something very important for the physician assistant. It's an excellent program for somebody who decides that it's too much work, I'm too old, I had enough, I just want a very good job and stable one. So it's a very good, I would say, a very good suggestion to compile all the documents available. Also, what it will be very important is to keep track of the people that are successful. Those that match the residency, and we always try to bring those, to bring hope, because what people are losing along this process is the hope that they will match, and then to compile the resources, people who are willing to help. What physicians in Toronto are willing to take observerships? What other opportunities in the hospitals, in the teaching hospitals, we should work more closely with them to provide opportunities, because especially like for clinical trials, these IMGs are extremely important, and they can work tomorrow as in a clinical trial. They might take a course at Michener Institute for clinical trial research, and then they can land a job of 120 just using their MD, or they can be medical liaisons, and again with pharmaceutical companies and so on. So all these resources that you don't have to drive the cab, you don't have to deliver pizza, you can, with an MD in Canada, you can work for the government, you don't practice, but you can have lots of opportunities. So this, we have an entire list with ways of really making a very good, and they are free to use, opportunities to a changing career for those that, I don't know, decided that it's too much.
Excellent. Excellent, thank you.
I
table. So I just wanted to underscore the work placement opportunities. I think it's already been touched upon by some of the other tables. But it sounds like there are a number of local initiatives that are doing great work in terms of creating work placement opportunities. So is there a way to be able to share that model and replicate it and create more opportunities across the city? Another additional piece around that that hasn't been mentioned was to continue to provide support in learning how to understand the exam process, how to do multiple choice questions if that's what it is, or the practical exams, which I think is already happening but is important. In terms of the long-term objectives, we didn't get too much detail into the discussion of which priorities were important, but our colleague here stressed the importance of separating professional issues versus political issues, and maybe that's a lens through which we can start to look at the different priorities that we might be undertaking.
What do you decide your priorities?
Actually, the application procedure is so cumbersome that we all need to get into an organization where we can help everybody getting a notary there and there itself, and printers and whatever is needed for the application procedure, because you have to run helter-skelter for the procedure. That is what I think.
Okay, Mars, can I add something? Can I add something?
Go ahead.
So I think that even this is an excellent opportunity. I've never been to such a group. I mean, I've attended so many advocacy and stuff. But even now, for this group, how are we going to sustain? We need funding. The moment you step out of your house, you need money. Same way, in order to keep this going, we should think of how to sustain this and maybe make some proposals, apply for some funding from the government. And like they talked about that 211 doctors line. So there's enough resources here and enough expertise and information to be able to guide the new people who are coming in, or those who are already there and don't know about this, because we are just a small pocket. I'm sure there are lots of other people who need this kind of support. So even immediately we have something on our hands that we should at least aim for. Maybe if not the ministries, maybe Ministry of Health, maybe Trillium, maybe United Way, even a one-year kind of a project to sustain these activities. So that would be, and the other thing I would strongly advocate is we should think of, like it was mentioned, professional and political. So there's need for policy changes, there's need for advocacy. For us, we all know, we are already the converted, we are preaching to ourselves. We need to have the people here who are able to make decisions and able to make changes and negotiate small changes. Like for example, the foreign trained doctors and international medical immigrant doctors, the difference. So those, because systemic change won't happen overnight, but those are small pieces where you can negotiate. And maybe the fairness, somebody was there from the Fairness Commissioner's office, and they said, come and tell us. So we need to bring, because they are there for the fairness part of it. So as a group, rather than individually, people need to go and represent with some, not something which is impossible, but here are 2 or 3 practical suggestions that are implementable, and policy change needs to happen. And I'm on another regulatory body and I've seen it happen. When all the stakeholders are at the table, it's amazing what can happen when they hear the stories. So I think those should be strong.
Has every table had a chance?
Can I add a
present?
very short statement regarding the policies and the FMGs and IMGs? The offshore schools very soon will change the rule that before they had to do USMLE 1 and 2 and then to do the Canadian one. Very soon they won't need this one. So many IMGs from Canada would match in US. So very soon it will be a very high competition for those ones, because they were deterred by having to do USMLEs plus MCCs and so on. So in the next year this will be more. Yeah, they can go directly here with the USMLEs.
Can I add, we all talk about policies, we talk about professional support. There's a big missing piece here. There is the personal support. Coming from a healthcare background, working for an organization, there's the mental piece. A mental piece of the fact that 2 people, husband and wife, are both trying to chase the North American dream. They have a child or children that they're raising. Their children or child are in this public school system. And there is a mental health issue. Like it or not, third world countries, you have to admit it. We have a way of hiding third world mental health issues when we're back home. When you're here, can't hide it. So is there any way, if we're going to request funding for daycare, as extra financial support, we need some mental health support. And I would advocate mental health support, and this is not belittling any Canadian Caucasian. We need a cultural sensitivity in that mental health support. I don't need someone who's from University of Toronto social work, does not understand why I don't like driving a cab. I need that instead. If I can have someone who is themselves to go through the system, and I can talk to, I can bounce off ideas, I can do individual, I can do couples counseling, I can do family counseling. It will make chasing the hurdles for these accreditation a lot more plausible. So somehow funding like that has to be available.
Thank you very much.
So I just want to have 2 minutes to say something. Unfortunately, we didn't have the chance to talk about. My name is Fernando Rivas. I'm the president of the International Doctors Network. So thanks. Where is Nicodemo?
He's head out.
Oh, okay. So what brings me here, I'm not going to say about issues because everybody knows issues, solutions. I'm going to say something what brings me here. We have been working with international doctors for almost 4 years now. And what brings me here is we need another piece. We create a group talking about networking and be proud of being doctors. We never say I was, because I am. Second, networking and to show us as professionals, because there is a big issue trying to ask people to allow us to not only touch them, to examine them, to help them. People is afraid because they don't know us. They might think we are not professionals because we are not qualified. Because many of regulatory bodies or anything is saying you need to upgrade your skills. You need to upgrade your grades. Everybody's talking about upgrades, and I will see about upgrades. Oh my God, I had the opportunity to know people that it's really, really the level is my professors.
Yes.
People they have to admire and respect. Then the third thing is, I'm here because this is the next step that we wait in our organization. We get that organization as presenting us as professionals. Now we need to connect with the community. That's why I'm here today, because I'm seeing here an option for the community to start to seeing us as a hope. Because it's not only our issues, our problems, it's the community has issues with help that we can help to give back to them too. So that's why we are here. That's why I'm here. And I just want to say, networking with the community and empower the community to help us to help them.